And then we land on, really looking at what's the content, what's actually in the standards of practice. So the first section, we actually just give an overview to what are the ethical principles that are covered. We go through the interpreting protocols, pre-session, during the session, post-session. Look at some of the guidances in terms of the roles and interventions of the healthcare interpreter roles. And then we actually launch into a exercise where folks actually have an opportunity to, crack open the standards of practice and look for some guidances that might be helpful in certain situations. So that's the exercise that we'll kind of zoom through a little bit later. And we talk about how there may be ethical dilemmas, that the standards of practice aren't necessarily going to give you a black and white answer to every situation, that there's a lot of judgment, and it's a practice profession, so folks are going to have to use their professional judgment. We then look at how the standards of practice and talk about how you can't just get it through a 2-hour training, and that actually there's a need for a lot more training. So we just kind of go through the benefits of training and then look at what are some of the resources that are available. Then there's a little bit talking about, well, of all of these, there's all these important interpreting skills that are required, and that there's all, training that's important. We talk about how, in reality, the reality doesn't always match up with what's kind of needed, with the ideal. So we talk a little bit about ad hoc interpreters. And that pretty much finishes up that first section where we're talking about the importance of the standards. So then we talk about also the current issues, and for, this section obviously will change a lot. It'll depend on what's happening in the field. But right now we've identified the questions of certification, implementing Senate Bill 853, which will actually require, does already require that commercial health plans have interpreting services or language services for their limited English-speaking members. And then also looking at recommendations in getting financing, drawing down federal financing for interpreting for Medi-Cal patients. So we talk about certification a little bit more. These I'm going to just run through. These are actually the particular regarding those different issues. And then we go into the last section where it's, trying to give people a sense of what CHIA is about, give them a sense of our mission, our vision, who our members are, and then also trying to encourage people to become a CHIA member. Okay, so does that kind of give you a sense of what we cover in the 2 hours? I know it was really quick, but I just wanted to give you some sense, and hopefully that it might be something that you can envision that you actually would be able to talk about. Certainly with some of maybe the current issues, you might need some background, you might need a little bit more information to be able to talk about that. But I would bet that most of the folks in this room are already pretty comfortable with most of the content that's in this PowerPoint training tool.